Heart attacks, also called myocardial infarctions, are very common. Chest pain is the most common warning sign of a heart attack. But there can be other symptoms like lightheadedness, nausea, shortness of breath and sweating. Symptoms can be severe or mild, and are often different from person to person. Some people may not even notice any warning signs of a heart attack. Heart disease is the leading cause of the death. It is also a major cause of disability. There are many things that can raise your risk for heart disease. They are called risk factors. Some of them are natural, you cannot control, but there are some risk factors that you can control yourself. Risk factors of heart attack that you cannot control. First is age. Your risk of heart disease increases as you get older. Men age 45 and older and women age 55 and older have a greater risk. Second is, in women heart attack risk is different from men. For example, estrogen and progesterone, female hormones, provides women some protection against heart disease, and women are less likely to have heart attack before menopause. Their chances of heart attack increases many folds after menopause. In men, diabetes raises the risk of heart attack. Third is family history. You have a greater risk if you have a close family member who had heart disease at an early age. Fortunately, there are many other risks that you can control to reduce your chances of getting heart attack. First is hypertension. High blood pressure is a major risk factor for heart disease. It is important to get your blood pressure checked regularly, at least once a year and more often if you have history of high blood pressure. Take steps, including diet and lifestyle changes, to prevent or control high blood pressure. Second is high cholesterol level, especially LDL and triglycerides. Under control, high levels of cholesterol can clog your arteries and raise your risk of coronary artery disease and heart attack. High fiber diet and regular physical exercise can lower your cholesterol. High levels of triglycerides may also raise the risk of coronary artery disease in women. Third risk factor of heart attack is overweight. Stay at a healthy weight. Being overweight or having obesity can increase your risk for heart disease. This is mostly because they are linked to other heart disease risk factors, including high blood cholesterol and triglyceride levels, high blood pressure, and diabetes. Controlling your weight can lower these risks. Fourth is wrong eating habits. Eat a healthy diet. Try to limit saturated fats, especially butter and cream, foods high in sodium, and added sugars. Eat plenty of fresh fruit, vegetables, and whole grains. Fifth is sedentary lifestyle. Do cardio exercises, walking, jogging, cycling, swimming. Exercise has many benefits, including strengthening your heart and improving your circulation. It can also help you to maintain a healthy weight and lower cholesterol and blood pressure. All of these can lower your risk of heart disease. Sixth is alcohol. Limit alcohol intake. Drinking too much alcohol can raise your blood pressure. It also adds extra calories, which may cause weight gain. Both of these raise your risk of heart disease. Men should have no more than 2 alcoholic drinks per day, and women should not have more than 1. Seventh risk factor of heart attack is smoking. Don't smoke. Cigarette smoking raises your blood pressure and puts you at higher risk for heart attack and stroke. Eighth is stress and worry. Manage stress. Stress is linked to heart disease in many ways. It can raise your blood pressure. Extreme stress can be a trigger for a heart attack. There are ways to manage your stress include regular exercise, listening to music, focusing on something calm or peaceful, and meditating. Ninth is uncontrolled diabetes. Manage diabetes. Having diabetes doubles your risk of heart disease. That is because over time with high blood sugar from diabetes can damage your blood vessels and the nerves that control your heart and blood vessel. So, it is important to get tested for diabetes, and keep it under control. 10th, that is last risk factor of heart attack is insomnia or sleeplessness. Make sure that you get enough sleep. If you don't get enough sleep, you raise your risk of high blood pressure, obesity, and diabetes. Most adults need 7 to 8 hours of sleep per night. Make sure that you have good sleep habits. Another problem related to sleeplessness is sleep apnea, causes people to briefly stop breathing many times during sleep. This interferes with your ability to get a good rest and can raise your risk of heart disease. These are 10 risk factors of heart attack that you can control to prevent heart attack. Thanks for watching the video. If you like the video, please like, subscribe and comment the video.